Hi. How long has he had the fever for?
I was at school and my mom was babysitting.
In 2006, in the Saskatoon Health region, we had the Health Disparities Report that really compared the health equity between the core neighborhoods, which is where the bus is situated, or the inner city neighborhoods, the low-income neighborhoods, with the rest of Saskatoon, the Saskatoon Health region. And it was very clear from that report that there was a great disparity in issues around suicide, mental illness, sexually transmitted disease, and access to health care.
Ma question est plutôt une curiosité. La collaboration s'installe comment? Quels sont vos trucs pour pas que vous ayez de compétition avec un système déjà existant? Comment on peut, dans des initiatives où on va ajouter une valeur ajoutée à un système déjà existant, comment on peut améliorer la collaboration? Avez-vous des trucs là-dessus?
I'm not sure I'd call this a trick, but I think in the wisdom in the Saskatoon Health region and the Ministry of Health, we actually get funding for facilitation. And we have primary health facilitators that ensure that the collaboration between team members stays on target. And we have that assigned to each of our primary health teams across the province. Pat Stewart is here, one of my colleagues who is the facilitator for the health bus, and ensures that we have a common goal, we have a common purpose, and we ensure that the itinerant members are kept informed as well. And it is an ongoing big job. There's a high level of poverty in the core neighborhood of Saskatoon.
I get great joy in coming to other communities across Canada and anywhere we can go to talk about what we are doing in Saskatchewan around primary health care. We're creative and innovative, and we do it on small budgets.
There is a hospital in that community, but again, we don't believe that many of these folks need to be in hospital or even need to be going to ER. They need other types of care.
Exactly 2:20.
The session on the Saskatoon Health Bus was a great example of literally taking it to the street. It was a really good example. And for me, it was a particularly interesting example because it was a unique combination of paramedic and nurse practitioner, which is also something that's going on where I come from in Nova Scotia. So it's neat to see these models picking up pace and getting some traction in the community.
In 2008, we partnered with MD Ambulance, who is an EMS service, private, in Saskatoon Health region, and we went together to the Ministry of Health and got their approval and some funding to start on a 6-month project of the health bus. And after 6 months, it was so successful, really, we just moved on from there. Creating a shared work philosophy between the two partners that are on the bus. The load and go is really the paramedic or the EMS side of go to a car accident, get them going, get them onto the ambulance and into emergency. I mean, that is really their way of thinking, and so it was really interesting for them to go, well, what we really want to do now is load or invite people onto the bus and just wait a minute, let them tell their story.
Having epilepsy? When were you diagnosed having epilepsy?
Actually, I was born with it, apparently.
Because if they can't tell their story in their way, then they're never going to be able to get the care that they really need. So that's been actually fun. We did lots of team building, lots of orientation with the folks that actually stepped up to the plate to be part of the bus.
It was clear that trying to work with existing services and programs and trying to if you're going to build a new program and mesh it within it or connect it to those existing services is a really important step, and not to create something that's new or standalone. So the message around integrating new service structures for vulnerable populations, I think, was a really important thing to do, and probably an important thing in any next step as a group gets going.
The governance was, again, very interesting for me, and I'm very interested in the governance of partnerships in the community. It was, as I've mentioned, co-managed by both the private and the public. So we had a representative from each side doing the governing. It is challenging, I would say, and we continue to work out lots of glitches, especially around the fiscal responsibility, who orders what and who pays for what, and how do we actually approve that. So we've been working through different policies around governance, but I would say overall this has been a very positive relationship.
The particular innovation, specific innovation, may not have the data to support it, but the literature does. We already know what upstream work does. We know what population health and prevention, disease prevention does for our community. We know that smoking causes disease, and we know that if we prevent smoking, then our disease rates will go down. We know those things. We have researchers all over the world that have information for us. All we have to do is access that information, that data, join it up with our evaluation for this particular innovation, and move forward. I don't believe we need to have a pilot project of the health bus for 10 years in order to convince the lobby, the government, that we need more funding. As a matter of fact, to their credit, the ministry in Saskatchewan, after 6 months, saw that the health bus was already a success, because we did a 6-month evaluation, but we pulled in data from all over the place. We did a literature search and said, this is why it makes a difference in this community, in this particular community. So I don't think we need to wait years and years in order to convince people.
Hello.
How are you?
I think the next steps are really population dependent, in trying to think of, you know, what are the unique needs of those different vulnerable populations, so that next steps may differ for different populations.
Our key success factors, I've said, is certainly the partnership and the interprofessional linkages, our social accountability, and of course the community assessment and engagement. We do know that there's transferability of this project. I think that we could have health buses everywhere. We can have them if we can have them in the inner city, we can absolutely have them in rural Saskatchewan, and we can have them in all across Canada. I know there's buses across Canada, by the way. I haven't seen any that have the partnership of the nurse practitioner and the paramedic. But so just one final quote, and this is really from one of our clients. The health bus is not intimidating like it is when I go to my doctor. I feel more at ease discussing things with you. I like that you are so approachable and friendly. It's like sitting and chatting in someone's kitchen at home, a safe place. Thank you very much.